Hello, everybody. This is Boris, and we'll be starting the meeting shortly. Hope everyone's doing fine on this somewhat cloudy and muggy day, but it's at least the temperature isn't in the upper 90s anymore here in College Park, Maryland. Numbers are slowly increasing. We'll give it another few minutes before we start the proceedings of the meeting. Okay, it's now 2:01 and we'll allow others to join us. I think we're up to 26 participants. The bigger question will be whether we do have a quorum of the commissioners. I know we had some commissioners who were not able to join us at this traditionally low attended July meeting only because we're in the midst of a vacation season. But I'll begin my proceedings of the meeting and we'll get ultimately to a roll call as part of that aspect and then decide on how the meeting carries on. The meeting will carry on either or with or without a quorum, and that will either make it an official meeting or we'll use this time to have further discussions amongst the commissioners about and updates about where we're at with this final leg, if you will, of the incredible work of the Commission on Public Health here in the state of Maryland. So it is now 2:02 per my clock here, and it's my pleasure to call to order the meeting of the Commission on Public Health as established by the legislature and the governor of Maryland. Today is July 10th, 2025. The time is 2:02 p.m. My name is Boris Lushniak, and today I serve as the presiding chair. I'm joined, I can see, by one of my co-chairs, Dr. Meenakshi Brewster. And I think we were going to also have potentially Dr. Oluwatosin Olateju on as well. I'm not sure if she's on. Shane, do you see her anywhere?
I do not yet.
Okay.
I'm on. Can you guys hear me?
Oh, there
Okay.
you are. Sorry about
Great.
that.
And
Thank
of
you.
note that both Mina and Tosin are on vacation right now, so I do appreciate their attendance here as co-chairs of this famed group. Of note also is that Tosin is actually calling in from Africa. And so this has become quickly a global commission. So thank you both for your dedication. I'm going to remind the group because at times we need to be reminded of why we're here and what we're doing. This Maryland Commission on Public Health was established in 2023 to study and make recommendations to improve Maryland's public health system. It was initially set up as a 16-member body. We have now 15 people who are part of it because of some turnover that have not been filled in, and it's comprised of local health officers, academic partners, thought leaders, and legislators. The Maryland Department of Health is represented by the Deputy Secretary for Public Health Services, the Deputy Secretary for Behavioral Health, and the Director of the Office of Minority Health and Health Disparities. Many additional leaders and professionals are contributing to our five work groups. which includes funding, governance, and organizational capabilities, workforce, data and information technology, and communications and public engagement. The Commission's goal is to ensure the public health system is designed to help all Marylanders achieve their best health and a lifetime of wellness. Meetings are held monthly and streamed online. And for more information, those of you who may be visiting us for the first time or return visitors, a reminder, all our information is at a website called health.maryland.gov /COPH for Commission on Public Health. This is a public meeting. We have followed the requirements of posting a notification of this meeting. The meeting is being video recorded. By your continued participation in this meeting, you consent to the video recording. We ask that members of the public who may be attending to mute their microphones during this session. This meeting does not include a time period for public comments, and we will not be monitoring the chat function during the meeting. We encourage public comments to be sent by email to md.coph@maryland.gov. That email address again is md.coph@maryland.gov. We also ask members of the Commission to mute your microphones when not speaking, and please use the raise hand function to indicate that you wish to speak, and you will be recognized. And I'll ask Shane to help me out as people are raising their hands. Individuals who serve on the Commission are subject to Maryland's public ethics laws, and all have confirmed their agreement to this in their application and listed any conflicts of interest. And I'll now ask Shane to conduct a roll call of the commissioners to determine if we do have a quorum. We'll ask commissioners to say present when your name is called. Work group members, please post your name and work group in the chat box or the sign-in or on the sign-in sheet, which is now in the chat box because today's meeting is strictly virtual. Shane, if you will.
Thank you, Boris. Delegate Bagnall. Camille Blake Fall.
Present.
Christopher Brandt. Mina Brewster.
Here.
Jean Drummond. Senator Clarence Lamb.
Here.
Matt Levy.
Here.
Deputy Secretary Alyssa Lord. Boris Lushniak.
Here.
Acting Deputy Secretary Elizabeth Crum.
Here.
Tosin Olateju.
Here.
Maura Rossman.
Present.
Nicole Rochester. Michelle Spencer. Alan Twig. We do have a quorum.
Great. Thank you so much, Shane. And thank you for all who are in attendance here today. With the quorum being achieved, we will go through all the motions that need to be done at this point. Today's meeting is mostly devoted to informational aspects, but we do have a few things that we need to vote on, which is that the agenda has been posted and distributed to the commissioners. You should have all received the agenda as of yesterday. Are there any comments on the agenda? If there are none, I ask for a motion to approve today's agenda.
So moved.
That's Mina. Any seconds?
Second.
Was that Matt, a second?
Yeah.
Second.
Okay, great. And all those in favor of adopting today's agenda, please say aye or nay, or raise your hands on the, or say aye on the, or raise your hands on the screen.
Aye.
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 Any nays at all? Okay, today's agenda has been adopted. In addition, minutes from the previous meeting, which took place on June 5th, 2025, were posted and distributed. There was a corrected version sent out late yesterday afternoon, and that's the version that we'll be voting on. Any comments on the minutes from the June 5th meeting? Okay, if we have no comments on the agenda, I'll ask for a motion for the agenda to be approved.
I make a motion.
Okay, thank you. And a
Second.
second? Okay, thank you. Let's vote on the minutes. I'm sorry, the minutes of the June 5th meeting. All those in favor of accepting the minutes, please say aye. Raise your hands.
Aye.
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 Anyone not voting for the minutes to be approved? Any abstentions on this? Okay, that being said, we have now approved the minutes from the June 5th meeting.
Sorry, Boris.
Yeah.
I didn't catch who the motion makers were for that. I apologize.
I think it was Maura, was that you?
Yep.
As a thing, and Mina as a second.
Thank you. Sorry.
Right, no problem. So now we're going to do commission updates. I know we're all eager to hear how things have been going. As you know, we have gone through various phases in our commission's existence. There was an exciting phase at the last meeting where we adopted the slate of recommendations to go forward. Those were posted as per the legislation for public comment, and we're all eager to hear and get update on how that's going. I also want to, under this segment of talking about the commission updates, is to note to our commission that several of us had a wonderful meeting with the new Secretary of Health in the state of Maryland. And that meeting went really well. I think from our perspective, we touched upon several aspects of what we thought were important to share with the Secretary. Secretary has taken on this role, as we all know, quite recently. And to a large extent, we were able to, in a relatively 50-minute meeting, both update the Secretary, engage with her. So there was the initial intros and a gratitude to Secretary Shashami. The Secretary appreciated the phone call, noted that it was both a meet and greet, but at the same time, a well-placed time period in terms of this being embedded within the open comment period, and appreciated the role the group and the transformational opportunities that our group has presented to the state of Maryland, and specifically the department that she now has the pleasure of heading. She observed the importance of the engagement and input to the process, especially in light of the federal changes. So I would say that things went rather well in our discussion. Secretary also commented on the idea that they would, from the Maryland Department of Health, and you can understand this is sometimes a little bit off in that Maryland Department of Health obviously were part of our whole process. And yet we have Dr. Chrome here as relatively a new representative because of scenario. So Elizabeth, we welcome you to this group. We have a new secretary also that has been brought in at this stage. And so there was an eagerness, obviously, to become part of the public comment period as well. And so we did receive comments from the Maryland Department of Health about the recommendations. Some people would scratch their heads and say, well, how did that happen? They were supposed to be part of the process. In fact, they were, but because of the turnover of leadership, this actually was an opportune moment for that to occur. The other aspect, and I think Vanessa helped us out, I'm not sure if she's on this, as well, was that there was a mention that some of our recommendations entail not only work with local health departments, with the state health department, but also our recommendations entail the interdisciplinary nature of many of our public health initiatives in the state of Maryland, which dealt with other departments within state government. And so there was an assist from the Maryland Department of Health to make sure that other departments were looking specifically at the recommendations that were pertinent to those departments. And we received, I know Shane will brief us on where we're at in terms of comments from state agencies as well. So I just wanted the commission to understand that that meeting took place with the secretary, and we are in a good place in terms of moving ahead. We also invited the secretary to attend one of our future meetings, and hopefully we'll be able to schedule that in as well, so that you all as members of the commission can meet the secretary. Any questions about this meeting at all before I pass the baton over to Shane and to Sarah? So now I'll call on Shane to present commission updates, including the initial findings from the open comments. Shane, please take over.
Thank you, Boris. Right. Good afternoon, everyone. So jumping right into our normal flow of updates, I apologize, I forgot to move my arrow here. It's a little early to be August, but obviously we're in the last lap of this race here in terms of getting the open comments consolidated, reviewed, and out to work groups to reflect on how our recommendations may or may not need to be modified so that we are able to compile our final report and discuss and vote on that prior to the October 1st deadline. So it's going to be a bit of a sprint between now and October. And so what I really want to highlight during these updates, aside from the comment overview, is that we really are going to rely heavily on the commissioners to be engaged and provide their thoughtful feedback on some of these pieces to really make sure that it's a product that is authentic to Maryland, that represents the needs of Marylanders, and is something that will ultimately be sustainable and continue on after the sunsetting of this commission next June. So with that in mind, Sarah will cover some report timelines here in a bit, which will offer commissioners opportunity to provide feedback on different drafts. But we will be also meeting with work group co-chairs and commission co-chairs next Wednesday, the 16th, to begin drafting some early thoughts and feedback on those open comments that we've received, which by statute, the substantive ones must be addressed in the final report. Enough about the comments, though. The final thing that I really want to hit on here is this idea that just because the final report is submitted in October and the frenetic activity will conclude at that point, at least in terms of developing the report and the regular meetings that we have, there's still a whole period of effort afterwards that becomes more about educating folks and helping different coalition partners understand the work that we've undertaken and what our recommendations are. And so as an executive group, we are beginning to think about what that communication strategy looks like, what those opportunities to engage other partners are, and really who might need to be at the table in that kind of interim period well before the legislative session launches in 2026. So please stay tuned for that. And of course, we'll share that plan once we get a little bit closer on finalizing that with respect to how the commission and different functions will kind of go onward. So on the open comments, just a brief reminder / overview, we posted the draft slate on June 9th, which allowed us to go through and do a bit of polishing and some initial grouping of how these thematically related to one another. And I think we were all the better for that. We ended up getting some really good, thoughtful comments. I really wasn't sure how many we would end up getting, but the reality is we ended up getting 35 comments, and I'll go through those statistics a little bit more in a moment. But during that 30-day period, we reached out to a variety of partners to make sure that they were aware. And we allowed folks a couple ways to share their feedback with us. That was online at the Commission's website through an online form, which took folks right to the draft slate that was posted, as well as a Google form that allowed them to provide feedback by grouping of recommendations, or rather by work group of recommendations. And then we triaged them. We were looking at the recommendations as they came in and shared with the work group co-chairs and commission co-chairs. And of course, the commission received 1 or 2 updates as well. And then again, just a note here that by statute, we must address the substantive comments in the final report. We generally defined substantive as something that was actionable, it was constructive and specific enough that we could do something with it, as opposed to some broad statements of, I support this or I don't support this. And I think that instruction paid off because we, as I said, received 35 comments, and of those, 31 were substantive. In fact, just for logistics, I had to set a character limit on the form. And so each field had 2,500 character limit. And a couple of folks went over and emailed and shared us information separately. And so it really shows the level of effort and thought that people put into this, that we were receiving from them. All of the comments came in either on the form or through email. We did not receive any comments through the phone line, although that phone line was available if folks wanted to leave a voicemail. And we did arrange for a couple specific meetings at the other party's request. So, for example, as Boris mentioned, we met with the MDH secretary to share some broad overview and get some feedback, which ultimately led to the MDH submitting a comment, as well as the Maryland Department of Education Commission staff met with them earlier this week, and we logged their comment as well. With that in mind, the 4 that were not substantive, 1 was completely out of scope. It was about swimming pools. That's not really our domain. And then 3 were simply not specific enough for us to be able to take action with those. For transparency, they're still reflected on the registry and posted online in the link that I shared in the chat. So if folks feel differently about that, happy to chat, but that was kind of our initial review of those. Of the comments, about half were from organizations or people identified an organizational affiliation. Several were local health departments or local boards of health or some type of health coalition. As I mentioned, we had some great outreach from state agencies, which really helped us get some excellent feedback and some thoughtful feedback. In particular, the Department of Information Technology provided some really thoughtful feedback that I'm working to get posted online because it was lengthy enough that I needed to pull it out separately, but I really appreciate the thought that they put into that. And then the balance of those were, between different advocacy or industry groups. In terms of geographic diversity, I'd say it's a pretty fair spread. We got some folks from a variety of places in Maryland, as well as outside of Maryland, who were either posting on behalf of organizations or work in the state and had an interest in that. For the registry that's posted online, we don't have individual names listed just to help preserve some privacy, but we do list organizations and county of residence as identified. So that's, I think, pretty indicative of a good spread for the amount of outreach that we did. Of course, we would have loved to have as much as people would want to provide, but considering during our listening sessions how many comments we got from folks in those in-person sessions last fall, I think this is a really great expansion of those efforts. I will note, and we will document this as a limitation in the final report. Of course, our recommendations were available only in English and online, so that does limit some bit of accessibility. And that was to our communications and public engagement work group's credit, something that they've identified as a gap within the public health system generally about information being made available in languages or formats that are more accessible for individuals across the state, particularly in areas with high diversity. So something for us to be mindful of in terms of how this represents the population of Maryland and how it may be biased or skewed. As I mentioned, the comments are pretty substantive and thoughtful, so we are still unpacking a fair number of those. I would say in general, the themes were largely positive. Lots of expressions of gratitude for the work that's being undertaken, particularly in light of the challenges facing public health at this moment. Number of folks mentioning specifically that, yes, these recommendations sound great, but how are you actually going to pay for them? Which speaks to a need for us to think about prioritization and how we want to phase and sequence this work. That was actually something that came up in our conversation with MDH as well, recognizing that there are a number of initiatives at the department underway and wanting to make sure that we work collaboratively to bolster the work that they're doing and support that, but also phase things in a way that is feasible and doesn't necessarily give the impression that this final report is, infeasible or not implementable as it is. So we want to be thoughtful about that as we reflect on our recommendations and what changes might be needed going forward. You may recall during the development of the recommendations that Commission staff had on the templates shared with commissioners and work groups, different fields around who the implementing entity might be, as well as what some of the criteria for success might look like and so forth. So we would certainly encourage work groups and commissioners to reflect on what are those additional bits of detail that we can add to some of these recommendations that will allow some of this prioritization to occur a little more seamlessly, as well as thinking about how things might be scaffolded and articulated in. In that vein, some folks did identify that while the recommendations might be good or headed in the right direction, it felt like a bit of duplication of effort, or that there was potential to reduce some duplication. So again, being cognizant of what programs are out there and available, we recognize that while we were blessed with the talents of our academic assessment team, as well as the assessment efforts of the work groups, we weren't able to capture all the different things happening across the state, particularly some of the things happening at the state level with the different efforts and challenges that they were facing during legislative session. So there remains a bit of a gap there in terms of making sure that we understand as a commission everything that is currently going on and how we might be able to name that and support that so that we don't create additional bureaucracies or duplication of effort there. I will note one or two comments did specifically call out potential for things like regionalization. That's something for this group to discuss. At the same time, the work group for governance and organizational capabilities specifically put forward a recommendation around the shared governance structure and continuing to support that. So there needs to be some more conversation about what the right balance there is, and what does regionalization mean in terms of this group, if that is something that is of interest, which I know that there's concern from some folks about how to continue to make sure that community needs are addressed and are tailored to what the community wants versus one-size-fits-all approach. Multiple folks did call out that the recommendations varied in terms of depth and specificity. That was something that we as a commission identified ourselves. It's certainly the process of how we went about working with the work groups to pull these together. So there is opportunity for us, I think, to continue to refine that a little bit more, particularly as we look at ways to collapse these down into some broader themes and use these recommendations as stepping stones, or even a bit of a recipe, so to speak, of how to accomplish a broader goal. And I think the comments kind of reflected that a bit as well. With respect to outreach and communications, what really stood out to me were the number of folks who highlighted plain language efforts and needing to have access to different modalities of communication, and frankly, amplifying or advancing public health communications in general. So again, I feel like our communications and public engagement work group did a good job of kind of keeping their fingers on the pulse of that need, and what we heard was kind of in support of that. And in that vein, you know, being mindful of how do we continue that going forward with our own work, and not just assuming that the completion and submission of the final report is it, in terms of continuing to advance these efforts. And with that in mind, the last thing that kind of jumped out was making sure that we have an opportunity, as this group in particular and others engaged in the process, of identifying what those existing programs are that may be worth scaling or improving upon, as they align to our recommendations, so that, you know, again, we're not supplanting or overlapping anything. So with that in mind, at this stage, wanted to kind of open it up to commissioners and folks on some reflections. You know, the recommendations have been out for 30 days. We've had ample time since we started this process back in April of developing and crafting these. We've gone through different iterations of language and structure. So, you know, really curious for the commissioners how things are resonating with them, what they're hearing from their community members. Since then, you know, where is their effort to refine or restructure these so that we achieve a much more kind of streamlined story to tell? And then in that vein of duplication, what things are you aware of that we might want to document or lift up as a kind of example that should be shared or highlighted? As well as thinking about prioritization and feasibility. What are the things that maybe aren't legislative in nature and a little more policy focused that we can begin working on and have some early successes with? And how do we want to sequence these things to achieve a successful outcome, not only for the report, but of course the broader improvement of public health in general? And then, you know, Sarah's going to talk to us here in a little bit after we talk about our reactions. You know, the final report is, we keep laughing in our staff meetings that the time is ticking. We're fewer than 90 days, I think, between now and our final report date. And so, you know, with that in mind, what are the hopes and desires that the commissioners want to see in that? And what do the staff need to know that as we're working with the report writer, what are the different themes that you want to see reflected in that? And we do have some early thoughts that we want to share with you just to kind of react to or get your reactions to, but that's kind of where we are the moment. And we'll come back to this slide in a second. Sarah's going to give us an update on the final report timeline.
Yes, thank you, Shane, for that. And I wanted to really make sure that everybody was aware of the work that we have been doing and continue to do for the final report. We have a big deadline of that on October 1st. So we have been working with a contract writer concurrently as we have been working on the recommendations these past few months. And during this public comment period, building off a lot of the work and information from the interim report and the assessment report to create the sort of basic framework. And now, as we are into July and working on getting to these updated versions of our recommendations, we will now be able to work with the report writer to update these recommendations and plug them in. And as you can see here on this sort of high level timeline in front of you, during this month of July, we will be responding to comments and update the recommendations as Shane mentioned. And a big part and a big priority now for us is then figuring out how these recommendations are going to be narrated within the report itself. That is, as she was mentioning, I think a big part of the discussions we hope to have today. But figuring out exactly now that we have a great list of recommendations and we've gotten feedback on them, how the commission wants to create the full narrative for the report and how we are going to prioritize, how we're going to identify these themes and make sure that we are creating and presenting a comprehensive and actionable presentation of all the work that has been done by the commission. So moving into August, we will have a semi-final draft available for review by commissioners to consider and make sure that everything is looking like something that everyone can support with a final draft review in September. That will be looking from September 15th through the 24th with the final meeting of the commission and to vote on the final draft on the 25th. So that's a big date to be looking forward to. So repeating what Shane said, the clock is ticking, but we have a lot of great content and have a lot of great information that we've been working on for the past couple years here with the commission. So we're very excited to be looking and talking about the final report.
Great. Thank you, Sarah. And then the last bit that I have to share before we open things up for discussion is looking at some of the thematic organization and how we want to really tell this story. Our work group structure has been really great for accomplishing the work and getting to where we are. But what we've really seen, particularly as we've looked at the recommendations and where the need in this process and future system for Maryland's public health needs to go, we need to break down that work group structure a little bit more because some of these things are really so cross-cutting. And so the themes that really emerged as we were unpacking the recommendations and the open comments that we received centered around this idea of partnerships really lead to successful programs and embodies that idea of the public health 3.0 model, particularly with a local health officer being that chief health strategist in their community. So it really does take a village in some respects to accomplish what we're looking to do. Continually, this idea of efficiency within the government structures as well as local levels and figuring out how to improve agility, how to promote autonomy while capitalizing on the back office structures and different relationships that keep things flowing in a shared governance way. So how do we modernize and update where appropriate, but also look at efficiencies? And this also includes things like citizen access to digital resources and programs as well. So not just this idea of administrative efficiency, but also thinking of it more of a customer service mindset as well. No surprise to this group, given how much we've talked about it, but the intersection of primary care and public health and the role that local health departments play in being a critical safety net in some cases, but also key partners for existing safety net providers in those communities. So bolstering that and uplifting it where needed. Certainly supporting some of the efforts, or rather all the efforts that MDH has undertaken around that, but acknowledging that there's opportunity for more and that some of these divides are artificial in terms of how we view clinical medicine and public health. And then finally, based on the work groups, based on the feedback that we've received, as well as the Commission's own adoption of this as a value, health equity remains a key cross-cutting theme here as we figure out how to address the lagging outcomes in some communities that are really holding back the state as a whole. And we see some of these really resonating within the state health improvement plan that we heard from MDH about last fall, and acknowledging that there's an opportunity for the Commission to leverage and support that work, and particularly the role that local health departments play in bringing that to bear as kind of boots on the ground, or for lack of a better phrase, retail endpoints, if you want to think of this more in kind of a business sense. So all of this is subject to change, but as we've kind of thought about how to encapsulate all of this, it's the public's health in all policies, health in all places, and health for all. And so our hope today is that we can really get some good feedback from you folks on how this does or does not resonate with you, and where there's opportunity to refine this a bit more. And from there, we can continue to work with the writer as well as others on getting the report structure pulled together and our recommendations in a thoughtful package that will encourage folks to implement them and not feel like they're being overwhelmed with 60 different recommendations just by opening them. So I will turn it over to Boris now.
Great, thank you, Shane, and thank you, Sarah, for that rundown. We're going to have sort of a lot of, at this stage, we've kind of done the gist of the reporting to the Commission and to our visitors here today about, what has curtailed over this last, 30 days plus. It is now sort of the time period where we want to kind of turn to you all. And if you can go back to that slide first, before we go to reaction to comments, Shane, the slide about the report and the report structure. I do want to sort of, now put it out to the Commission members. And again, if you do if others have comments, please put them in the chat, although we're technically not monitoring the chat, but we'll keep an eye out there. But really, this is a meeting of the Commission for the Commissioners for us to look at several things. And you've all received the questions that we're going to be going through shortly, which is the next slide. But I really wanted to start with this, right, which is the report structure and the themes. And in essence, it's really the final question that we're going to answer. But because Shane and Sarah had done a good job in terms of putting all this together, let's start with the report, and then we'll work backwards from there. And ultimately, I'm going to pick on somebody to begin sort of part of the discussion here, and that's our, I'm not sure if Representative Delegate Bagnell is on, but I know that Senator Lamb is on. And I'm going to start with you, Clarence, in that, you know, the report really goes to, yes, to the citizens of the state of Maryland, but in essence, it goes to the legislative branch and to the executive branch of this state. You know, when you look at this structure of the themes that we're presenting from your needs, is this something, how would you comment on this on terms of the direction we're taking? Are you out there, Senator Lamb? If not, then, you know, I think Scott from Land's office is on, but I'll sort of then curtail or take this discussion in a slightly different perspective, and that's to our whole group. So the last question that we posted is basically, what would you hope to see in the final report, and what themes resonate with you? Are we heading in the right direction, commission members? Raise your hand to comment, please. And I don't see everybody out there, so I'm not sure if somebody can help me monitor where we're at.
You may have to take the Socratic method.
Okay, so let's look at it from a perspective of, you know, okay, Clarence had to drop off briefly to take the call, but I do think you put the direction of the report. Okay, so that's a good thing to hear. We don't have Representative Bagnell on, do we, Shane?
We don't, no.
Okay, great. So again, sort of putting it out there, are we heading in the right direction with this report structure and themes? And once again, the commission will have the ability ultimately to play a role as we piece things together. But we're already at the stage, as mentioned by Sarah, of having this outside runner doing things. Are we heading in the right direction with this? And the Socratic method can be utilized, but I prefer for commissioners to opine in at this point. Well, I'll start with, you know, I know everybody's on the road, but Ina, are you on?
Yes, I am.
Any
Thank
comments?
you.
I know we discussed this already, but you from a local health department's perspective.
Yes, absolutely. Thank you. And I think, yes, I do think the report is in the right direction based on what was tasked by the legislation, which was primarily, again, to study the governmental public health infrastructure and make recommendations to improvements in our public health capabilities via that governmental structure. I think there are clearly areas where, given the timeline for the assessment and the resources that we had to conduct the assessment and you know, move the volunteer work groups through their process, there definitely are areas where we need further exploration, where this commission wasn't able to effectively delve into those gaps or lingering questions about public health capabilities in Maryland, that I'm eager to see the report make recommendations for those. I hope whether it's the legislature or the overall public health community and partners involved, take up that torch and really do a more in-depth exploration of some of those issues and make recommendations related to those issues. So the report and the recommendations that we've generated thus far don't, I think, fill every corner, but they do move us in pretty fundamentally positive ways, I think, forward for Maryland's public health. It will, you know, it's difficult because many of these recommendations are coming at a time when our fiscal climate, both at the state and projected federal level, are quite dire. And I think we need to, you know, realistically understand the strain that places on what's already existing, and building new things or even dedicating resources to move to a more efficient place, that may be very difficult in the current fiscal climate. But as we've talked about before, it's really important for us to maintain sight on what is needed in the long term and put forth recommendations for what is needed in the long term, so that hopefully we can make some incremental change towards that over the next many years.
Yeah, and that's sort of my comment on all this is that, ultimately, I mean, let's be honest, right? If we were trying to time the release of this report, we wouldn't have chosen this time period, right? In light of everything going on at the federal level and light of everything going on at the state of Maryland level. That being said, guess what, folks? Guess what, fellow commissioners? We don't have a choice, right? The legislation says we're doing it. And I think we have to, sort of going back to what I've always been promulgating since the beginning of this, we have to be aspirational, but with the idea of being also realistic under these circumstances, right? And I think, once again, part of our audience is, I mean, there's multiple audiences here, which is at times very difficult to write a report for multiple audiences. Yes, it is as important for the executive branch of the state of Maryland. It is important for the legislative branch because those two branches, obviously working together, can make major decisions. But also, this is a way for us to profile public health throughout all of our communities. And I think that's the other aspect of this, is to make sure that people understand in a time period where there's a lot of questioning about bigger public health. I just want to make sure our report does. And, by this setup, which is, you talk about partnerships, modernization, efficiency, primary care and public health, health equity, and with the taglines, my hope is this appeals to people, right? To look at this report and say, it reminds me of oftentimes the hidden heroes of public health, the hidden mission of public health, and, even in these difficult fiscal times, to make sure that it remains a priority on people's list of things to do. Right. And I think that's the way I look at this report. Right. That would be my expectation and my hope that this permeates through. Now, the report is going to be a big report. Right. And the real question is going to be to make sure that we take, as we have this writer and with all of our input, making sure we get the messages out in the right places and through the right communication, methodologies, right? So we don't want to sort of get encumbered with a whole lot of words that ultimately are difficult, right, to get through. And yet, obviously, there's going to be a whole lot of words in this report because we did, and our working groups did, a whole lot of work to be able to do this. The assessment team did a whole lot of work to be able to get that through, and we want to be able to make sure that this all shines through, right, in terms of the work. Now that Mina and I started this conversation as co-leads of the commission, any other commissioner that wants to opine, since you get the gestalt of where we're going on this. Matt, you're on.
Good afternoon, everyone. I guess I don't know how many comments you normally get. 31 seemed low to me, but they're good comments and they're substantive, then that's really what really matters. And we gave people an opportunity to weigh in. I think we have to, I'm excited about this report. And I think it's such a comprehensive approach to this but I also want to caution us that it's going to take us several years probably to get all these things, get people on board with supporting all these things, and we're going to have to be in it for the long haul as far as bringing it to the right people to look at and evaluate. And I just want to caution us about being, sort of going really hard and then getting frustrated when they're like, well, we're in a bad budget year. And I think we need to pace ourselves and understand that it's going to take us a while to get this all moved through. especially as you said, Boris, in this this climate. But I'm really excited about it. I did have a slight, I did have a question. Are we doing an executive summary as well with this? So that if those don't want to read the whatever 150-page report, they can read and get the gist of it, or they can go to specific sections that they really care about to be able to read that quickly.
Yeah, yes, that is the intent, right? Is to make sure that we do have this executive summary that summarizes. Shane or Sarah, do you want to be any more details on that?
Yeah, absolutely. We'll have an executive summary, and we're also looking at the Indiana report in terms of how that summary was structured with all the recommendations in one place, plus how, thematically we might be able to, structure the subsequent portion of the report so that the recommendations really are aligned to tell more of a story. So it's going to be available in a couple ways for folks, depending on how they want to look at it. If it's, I want to just, tear this to-do list out and run with it, that's an option. But if you want to read the whole story and really kind of get the detail underlying it, as well as the findings and the rationale, that will also be included in the body of the report. I'd also like to add, because Sarah's been working really hard on this, but the briefs will also be another communication tool that will help encapsulate and pull out some stuff from the final report in a way that goes a little bit deeper and can be used as an educational resource.
Great. Anything else from your perspective, Matt?
Not at the moment.
Great.
I think that everybody's done some incredible work here, and I know it's been a labor. It's been a labor of love, but also one of need and passion, I think. So I'm thrilled to be part of this.
Great, thank you, and thank you for all your contributions as both a member of the commission as well as your important role on the data and IT working group, Matt. Others, reflections, and again, I'm going to sort of change the theme shortly, but any other reflections on the report structure? I think we are up against, as Matt mentioned, I mean, the importance of having this executive summary. How do we get out the information to show that this was a very vibrant and it was a deep dive into, right, a 2-year deep dive into public health. We understand nothing is filled with a 100% perfection, but we want to make sure not only do we expose all the activities that we have done, but at the same time that we do it in a way that is, comprehensible to our varied audiences, right? And there may be bits and pieces that come out depending on your interest or areas, but we have to be able to make sure that we organize this well. And we'll go into a discussion shortly about how we organize the recommendations in a little bit. But any other from any commissioners, any other reflections on the report structure and the themes as presented here?
This is Camille. I was wondering, to Matt's point, and to sort of really encapsulate or the thinking that we've had all along about the cost associated, the tension between the costs that these recommendations implicate versus the need for keeping the recommendations as a big picture aspirational document. Might it be helpful for structure, and I don't know that we could do this, to really point to the over year or in the next 1 to 2 years, these are the top 5 things. I mean, and I know that may be troubling, but when you have these many recommendations, it's often helpful for legislators to think, well, which are the ones are most immediate from the commission's perspective that, if we have, we really want to lean in over the next year or two, or do you think that would be more work than it's worth?
Well, Camille, I think that's a great point. And Shane, let's go up to our question slides because we can actually make this a slight switch in terms of our approach here. So the last slide that you had up, This one here. So in essence is, we're touching upon now the second from the bottom, right? What sense of prioritization do you have in terms of feasibility, importance, or other criteria? And we're ultimately going to get to all these questions, but I kind of wanted this conversation to flow with the report beginning. But Camille, you bring up an interesting point, right? Do we look at, and again, this hits on touching several of these questions, right? So we have a slate, right? What are the ideas out there of consolidating, collapsing, or prioritizing? And, Camille, your point is there a top five? Is there something that we need to point out as a commission that we need to sort of say is, okay, if we are going to have this as a multi-year project, and we have to look at it again, there's aspirational components. We all know it's not just going to be, and I'm sure Senator Lamb would be the first to admit, this isn't going to be a bunch of pieces of legislation in the next legislative session that all of a sudden is going to checkbox all our recommendations. And not all of them are in the legislative branch. Not all of them, will denote a huge expenditure of dollars. Some of it is just approaches. But when it comes to that, how would we prioritize all this? And Camille, I guess your potential proposal for discussion to our commission is, do we prioritize by basically saying here's the top five that may cost money, or not, but here's where we need to start, right? And is that feasible if we look at all the recommendations to choose a subset as this is where we think things should start? Do we group them, collapse them, and make them sort of streamlined and basically group things together, saying here's the groups of things that need to be taking place, right? Because right now what we have is, we have a list, right? And that list needs to be further consolidated, collapsed, to further streamline. I like this approach of saying what is doable. It's going to take more work on our part, right? And submissions from us as commissioners to look at saying, this may be a homework assignment, in essence, is as we prepare, is what do you think are the priority ones, or how would you further streamline the slate? To Camille's point, is any further comments on kind of looking at this of saying, do we prioritize in terms of ... feasibility, importance, or other criteria? People's feelings. And Camille, I interrupted you. Do you have anything else to add to that approach that you were? So back to you, Camille, for a second.
No, Boris, I think you've really captured it. I just completed a report that was a legislative mandate looking at underrepresented behavioral health professionals, so BIPOC behavioral health professionals, and exploring why there is a dearth of underrepresented behavioral health professionals, and also what we can do to increase our workforce roles. And the work group had many, many recommendations. And we thought, well, in this period of financial austerity, in this time of Medicaid cuts, I mean, what do we think in terms of tranches? Do we want to highlight for the legislators in the General Assembly? We think all of these are important, but we really, given the moment, think these five. And so that's how we approached it. And I don't know that we could do that here because that was a very narrow question that we were exploring. But I do think that if someone's looking at an executive summary or flipping through, they're just gonna be, okay, just tell me what I need to know. Like, what did you most care about today, right? Which will be different than next year, or the year after, or the next administration, or whatever.
Yeah. Other commissioners comment on that approach. Is this something we should go on?
Oh, sorry, I was having trouble unmuting. Just, from it is going to be a difficult process to prioritize because
I think you're breaking up a little bit, Mina, so I'm not sure.
Frankly, are just so many critical building out a future public health.
Mina? Mina, are you still there?
We are essentially
Mina?
apps that cover
Mina,
multiple,
let me
or
interrupt
that's,
if you
I'm
can hear
sorry,
me.
you're not
Mina.
able to hear me? You're not able to hear me?
Yeah, can you maybe you
I can.
may want to turn off your video and see if we can just get your voice, because you're breaking
Okay.
up on this approach. So
I'm sorry about that.
you may have to start at the beginning.
Is that better?
Yes, so far.
Okay, I apologize. So hopefully it'll clear out soon. What I was saying was that there are so many there's so many significant gaps to our public health system infrastructure that I believe it would be an extremely difficult process to prioritize down to 5 foundational things that need to happen in order for some of the other things and recommendations to unfold in the future. So I feel like it's a good effort to have the discussion and to move towards a prioritization process of this, or in some way. I think it would be important for us to clarify what the criteria for that are in the beginning, and to be realistic about that process. I would be, shocked, frankly, if we arrived at 5 items that were first priority out of 60. I mean, I honestly, I feel so many of these are high priority items. And so, what we may end up with are some level of categorization. And whether you want to say high, medium, or low, or something like that, or just first, second, third, however we decide to approach it. But I do think if we go through a prioritization process, we need to be clear as to what the criteria for that.
It's, if you look at the comments, I know Scott
Prioritization may be just to 5, just given the significant infrastructure gaps that we have.
Yeah, no, I understand that it would be a difficult process, but so Scott from Senator Lamb's office, he's not a commissioner, but did write in, and I just want to make people aware that it is in the comment section, which is, at least from a perspective, as he writes, of trying to prepare future bills. It could be helpful to have some level of prioritization from the commission towards the legislative branch, which brings up another issue, right, in terms of how maybe not sort of so much the prioritization as this idea, and this goes into this idea of perhaps the second question, or our reaction to the comments: what can be consolidated, collapsed to further streamline this slate? Or in essence, is what, how do we divide things up? Can it be done in the fashion of who has the prime responsibility for each of these? In other words, do we sort of take these our recommendations, the draft recommendations right now, and not only potentially look at prioritization if that's at all possible, but look at responsibility of implementation of that, i.e., according to, perhaps may be helpful for Scott and Senator Lamb and Delegate Bagnell is to basically say, okay, legislative branch, here's where you are the lead. And here's our listing, and maybe look at it from that perspective, right? Which is who is responsible. And where it is interdisciplinary or multiple partners, we be bold enough to list a lead, if at all possible, and who are the relevant partners, without limiting it. Because what I don't want to do necessarily is to say okay, everybody else is off the hook, it's only your show. But maybe it's a matter of saying, who's the lead that we see it as that should be really looking at this? And maybe they can refute it, maybe they can pass the buck, maybe they can sort of share it with others. But is that an approach? Commissioners. I know it's kind of difficult to have this discussion while in a virtual mode, but Mina, you were going to say something. Go on, Mina.
No, just I think those are really good thoughts. We may want to just try it, and ask our support team to draft a process or some criteria that we apply towards it, and gather input from the commissioners or even from the work groups on those recommendations and just see how that evolves. I mean, at this late point, it may be difficult to come to a perfect outcome, but just the process of going through the exercise and identifying whatever the criteria are for prioritization, identifying those priority categories, I think would be helpful.
Others? And again, what we're discussing here is not only prioritization, but, and let's go back to that first question, right? We're 30 days out from our last meeting. We've all looked at this, and maybe it's going to take us a little while longer to sort of spend time looking at the comments that have come in. But, in essence, is what reflections and reactions do you have to these draft recommendations? How can we streamline any recommendations on that and prioritization? And I see Maura has her hand up. Maura.
Yeah, thanks. I do think I agree with everyone. I think it will be difficult, but I do think it's important to prioritize and perhaps categorize the recommendations to make it more readable and practical to whomever may take action. The other piece, and maybe I just missed it, that I haven't heard or read is the urgency. So why is it important to act upon these first 5 things, whatever, in the next year or 2 years, and the next thing, and why things, and I know this is difficult, why things have changed in the past 9 months in terms of public health. Otherwise, it might, given the other stressors and changes around us, it may be easy to kick the can of this report. And certainly we would all hate that, but we all know the urgency, I think, but how would the average reader understand the urgency to these recommendations?
Yeah, I think that's a great point, Maura, because what we've done is, in essence, is looked, and I myself am guilty of this. I basically say is what a bad time for us to be releasing this because of everything that's changed. But in essence, is you're almost changing the argument separately. This is actually the perfect time to be releasing this because of all the change. But we have to be able to communicate it, right? Why is this important? Well, it's important because of what's changing at the federal level and federal support of public health, and because of the repercussions that's going on. So although we may not get everything we want, right, in terms of saying, oh, this is going to be one big bundle, the reality at the end of the day is now is the time for us to be doing this because we are, and let's define it, at threat, right? The public's health is at threat, right? The health of the citizens, of the people of Maryland is at threat because of all this going on.
Exactly. Thank you.
Okay, we also have Aaron Hopwood has put in a comment in the comment section from Delegate Bagnell's Public Health Subcommittee. So that I think is a good thing, and I think that is our intent. For us to at least at some stage, right, as we're evolving into what would ultimately be a draft final report, is to make sure that we have that connectivity, Aaron, with the legislative leadership, and to make sure that this is fitting into what is necessary for them, right? Until October 1st, we have a lot of tweaking that can go on to make sure that this fits. But, and your recommendation that this go with subject and theme. Thank you very much. Maura, anything else from you on this, as long as you have the microphone there?
No, that was the most salient. Thank you.
Great. Thank you so much for your input. And I love your sign behind you. Others? So we talked a little bit about the final report. We talked a little bit about prioritization. We talked about the consolidation collapsing to streamline. Let's just sort of go through this idea of the 30 days out thing. And again, we can go back to any of these themes. I just want to make sure we're touching upon this and allowing the commissioners to opine on this. And I am not a co-lead of this forcing people to speak. So I'm relying on you to sort of come out and say what you want to say. If you have nothing to say, that's fine at this point. But I am, relying on you to help us out here. But also I want to introduce that third question into this mix as well, which is, from your own perspectives, we're very different people on this commission, right? There are people from all sorts of backgrounds, all sorts of interest areas. Are you aware in your own communities, right, of activities that are already working on the issues that might be scalable or need to be acknowledged to prevent duplication or supplanting, right? Here we tried throughout this 2-year process, almost 2-year process now, of us making sure that we've talked with the right people, have brought the right people in to talk with us, have reached out to the right people. But we want to make sure that at the end of all this, and this is important not only from the comments we received during this public comment period, but in essence also the outreach that we'll do in these next few weeks for people to be able to look at this and say, is there anything else that we're missing here? Or have we not acknowledged the work of others? Now, I know the Maryland Department of Health sent us comments, in the overnight time period. And amongst the comments are there is we're already working on this, right? Certain aspects of our recommendation. And that's great, right? We want to make sure that, that we acknowledge the fact that there is work already being done. From the commissioner's perspective, does anyone have any comments on your own communities and anything else that we can basically look at it from a scalable or a currently in motion activity, right, regarding any of our recommendations? So I introduced that as, in essence, what's going to be our final question as part of this discussion. So we now have an open slate. Questions 1, 2, 3, 4, 5 are all open for discussion right now. I have laid them before you, fellow commissioners. Any comments on all this?
So on that point, I know this has come up multiple times, is the discussion of existing effort, both at the state and local levels. And I think part of why some of these recommendations continued forward, because, keep in mind, these work groups were staffed with individuals from the state health department, with individuals from local health departments, and of course, many other organizations that are engaged in public health effort at local and state levels. And the assessment involved interviews and group focus groups and surveys from the state health department staff, from the local health department staff. And so a lot of all that collective input is really what's informed the recommendations from each work group. And I think it's really important to recognize that there are levels of effort already in place for many of these recommendations, both, again, from the state health department as well as local health departments. And the recommendation that comes from the work group doesn't necessarily mean that there's no work being done on this topic. But what it does mean is that for an enhancement of public health capabilities in the state, we may need more work or different kind of work or a different way of working in the particular topics regard. And so I think it would be helpful for specificity, right? So for example, if the local health departments felt as if one of the recommendation is duplicative, or it's already work that's being done by local health departments, then it would be helpful for those local health departments to clarify exactly what they feel is duplicative or what is being done that the recommendation duplicates and doesn't necessarily enhance. And same with the state health department. If the state health department feels like there's work already being done or the recommendation is already being performed somehow, or is already in progress, then it would be helpful to get that specific input from the state on that recommendation as to what specific services or programs or way or planned effort is at the state health department that would make a recommendation duplicative. But again, in large part, when the recommendations were formed, they were formed with the input, both through the work groups and the assessment process of various staff at the state and local levels.
Great, thank you, Mina. Others on this theme?
Of course, I would just add that the efforts are going to be ongoing. For example, we just met with the new head of MBH Health IT, and he's probably not aware of the recommendations, which we probably should send to him, so that as he builds his new models, he can incorporate these ideas into the plan that he's putting together for MDH, at least be aware of them. And I think as a collective, we maybe need to have some kind of a way to understand the landscape as it changes and filter that back to a central area, so that then that information can be brought to the person or the people or the organization that is building that model, so that if they may not want to incorporate it, but at least they're aware of it. I don't know how to do that exactly, but I think things are going to happen as we go. We need to continue to be aware of them and react to them and give them the information that's in the report that is relevant to what they're doing, so they can incorporate that into there. Because then we can start to almost seed these recommendations into all the things that are happening in the state that may or may not be directly related to this report and the funding for it.
Mm-hmm.
I don't know if that makes any sense.
Yeah, no, that does. And I think, again, it's that whole matter of, the connectivity that we've had in the past, the connectivity in the midst of transitions even, but also, until the report is issued, we have a stop, a deadline, right? It is a drop dead date of, October 1st that it needs to be issued. What happens after that is a continuation of some of our work. And at some point, we'll be discussing the fact that this commission does not sunset until June of next year. So we have 11 more months. I will tell you right now, it won't be at the same level of activity, right? So don't start sending me your resignations from the commission, right? We're going to be, but in essence we're going to be out there working with the Maryland Department of Health, working with the local health departments, working with many partners that may have, not been aware of this, right? And that's going to be part of our job, is to make sure that we are assisting with the implementation phase of this as well. But those are all good points, Matt. Elizabeth, I see your hand is raised. Elizabeth, please.
Thank you. So you actually covered one of the things I was going to say. I think reading the recommendations and listening to the conversation here just drove home a point for me of how do we go about making sure that this is top of mind and stays visible within the department, and how we actually have a plan to operationalize the priorities that we decide we can actually, work on and address. So we need to figure out how best to do that. And to Matt's point of, is this done through some sort of regular updating piece as a part of the health officers roundtable, which is a monthly discussion? Is there some sort of work group that's created? I don't really want to create a ton of extra work groups, but we do need to make sure that we have the structure internally to monitor, track, and ensure that we're making progress on the things that we work on related to these recommendations. The other piece I just wanted to comment on is the the I was struck by when the department went through and sort of looked at the recommendations in detail, how we were able to say, oh, we already work on this in some way, we're doing X, Y, or Z. And that difference between we think that we might be communicating very clearly about those types of efforts, but if you're getting that sort of recommendation of, well, you need to do more on plain language, X, Y, or Z, we might not be communicating our efforts very well. So it was just a take-home point, I think, from the department side of, while there's a lot of work going on, we probably can increase our efforts and become a bit more effective about disseminating and sharing the things that we are doing, because several of those items, there is work already underway. It's just maybe that we're not sharing that information in a way that's getting to the right folks.
Right. No, and I think that's a great point, Elizabeth, is that, when it comes to things like that, you have to realize, again, the commissioners, although had representation from the Maryland Department of Health and representation from local health departments and all that, the reality at the end of the day, the commissioners and the working groups were looking at the environment as they saw it, right? And to some extent, it's not that everything that's being delineated as a recommendation is a complete lack of progress in that realm. It very well could be we don't know much about it, or it's that extra emphasis. Okay, you're working on it, but boy, we got to figure out a way. How do we profile it even more, because it has made this cutoff list, right, of
Exactly.
a bunch of things that need to be done, and we view those, right?
Exactly.
But thank you for those comments. The other thing I want the commission to be very aware of is that, when October 1st comes around, yes, we issue this to the governor, to the state legislature, but also, we've had discussions that the rest of the United States are going to be looking at this, right? This is going to be a public report. One of our strong supporters in this endeavor has been the CDC Foundation, right? It has been working with us in terms of that. And we recently met with Judy and Megan and others from the CDC Foundation, but they're looking at this as being, an example, right, to the rest of the United States of what is doable, right? So I think we have to look at this is that, to some extent, the world, I'm not going to say that this is going to be the Magna Carta of public health, but this is going to be a major endeavor, right? Which we've put a lot of effort into, right? That we've been supported through by others, right? Our speakers who came in, right? Others who have CDC Foundation has supplied, incredible resources and incredible staff members who have gotten this things going. We have to acknowledge that. But part of the reason we're doing this also is to provide, yes, an example of what it can be achieved, right? Ultimately, that we have a responsibility to show to others that this is important. And the hope is that other states, may take on similar type of missions, right? To look at public health from the bigger picture. So I think that also, just by us doing this is already a sign that, that we're a bit different, and we're looking at this from a different angle, despite the environment we're in, despite all the challenges that are up against, that public health still, right, needs to be supported at the state level. So I think that's another important way in terms of looking at some of the impact from this report. Others who have anything else to say from the commission's perspective or commissioner's perspective? Shane or Sarah, do you have any questions or clarifications from what you've heard from the commissioners?
I think on the criteria piece for prioritization, we may need to have some more conversation with the co-chairs about that, just from the sensitivity of it and understanding what would be appropriate. Again, to my comments earlier, wanting to make sure that these recommendations and this process is really authentic to Maryland. We'll need more discussion around that to make sure that however we approach that does kind of align with that state-centric approach. State is in the state of Maryland, not just MDH in this regard. And not sure, Boris, if you're planning to now flip back to kind of the report structures and themes slide, but would appreciate some reactions and feedback from commissioners about that, as I don't feel like we heard from folks about whether or not that was close to the mark or not. So those are my reactions, but defer to Sarah, Dashanka, and Megan for their input as well.
Great. To our dear staff, anything from Sarah, Dushanka, or Megan on what we've discussed so far? And yes, my intent is to go back to that other slide to just finish up with our final question to make sure we're set on the final report, as people have had time to sort of process both the recommendations as well as how, a path forward on this. Dushanka, Sarah, or Megan, anything from you guys?
Just to sort of continue what Shane was saying, and just to encourage commissioners to continue looking at the list of recommendations and to really try familiarize themselves. And if you come across recommendations that you feel very strongly about or have more questions about, we would love as support staff to hear that. And please know that we have these meetings, but we welcome your input at any time in this process, especially as we are, as we keep saying, on the timeline. So just after this meeting, encourage everybody to just, whenever they have the opportunity, to keep on looking through those recommendations and thinking about sharing your thoughts with us.
Great. Thank you, Sarah. Dushanka or Megan, anything from your perspective?
I'll add, Megan put a note in saying that Sarah and Shane covered her thoughts as well. So thank you. First of all, I think this was a terrific discussion and good insight, and we are getting to the nuts and bolts of the end of the process. And I think it's important for all of us to think about why we are doing this work, why we were asked to do this work. There were issues and problems identified that drove us to having a statute that sort of laid out a very detailed process to take a look. And I think that we've also incurred in these 2 years additional problems, and even ones that we never conceived of or even fantasized about. So I do ask the commissioners to think about looking at how to aggregate the top level problems that we have, because ultimately the work, even though the whole infrastructure needs to be enhanced, there's no question we have a lot of investments that need to be made, but ultimately we need to move health, maintain well-being for the state. And we need to look at those problem areas that are going to give us the most bang for the buck, moving that forward in the state. And then secondly, I do think these issues of what's ongoing or partnerships, if we can move some of these recommendations in a more accelerated way, because they are tucked in with other work that's being done by nonprofits, by the state itself, at local levels as well, I think that would help us as well. I'd love the concept about a timed look at how this could be done and examples that were provided, and then also the audience for the different areas of priority. Because I do think we will have, in addition to governmental public health, to the legislature, to nonprofits, academia, there'll be a lot of people that would want to take time and move the state forward, because there's so much good in Maryland. So thank you all for the work that you're doing, and we look forward to this further next step. It's a little tough, but I know you're up to it because you've done such great work to this point in time.
Great, thank you, Dashanka. Any other reflections before we head back to that other slide from anybody? Raise your hands if you have anything to add on this. And if not, Shane, let's just go back one last time to the final report slide and finish off with that theme, which is again, report structure and themes. Feedback on this, again, we started with that part of the conversation. You've heard an evolution of our thoughts, at least some ideas regarding the recommendations and things. Does it now make sense that we follow these themes on the report structure? Commissioners, anything?
So I guess I'm not quite clear if we have enough recommendations to have a theme of primary care and public health. I know this is a topic we've discussed quite a bit and we feel needs to be explored quite a bit more. I don't recall having enough recommendations that they would constitute a theme in their own right, but I may be misremembering.
Yeah, but by my recollection of this is the sense that this, despite the fact there may not be a lot of recommendations or, how they dish out, that this is an important concept, right, that needs to be put out there and have a placeholder in terms of its further evolution, right, of how do we look at the world and the interspace of care of our health care of our population and the public health needs of that population. So you're right. I mean, I don't think we have a lot of recommendations on there, but the question is, as a theme, does that hold enough there to basically say, is this is something that we're designating as a area of further inquiry, further growth, right? We've always kind of told ourselves that we may not be all encompassing with every recommendation in the world, and yet we wanted to sort of point out that these are areas of importance. So that's my only response. Shane, or anybody from your perspective on as we're looking at that?
Yeah, I would say that Mina's spot on that, we don't have a significant number of recommendations specific to primary care. And as a staff, when we were kind of debating this ourselves, we were wondering, if you look at some of our earlier documents and drafts back to even the charter to the work groups, we kind of talked about this artificial divide between clinical healthcare and public health. And we started, and I'll note Maura just put in the chat, essentially what I'm getting at, that this idea of how do we bring those two areas closer together and integrate them and maybe remove some of that artificial divide. But we recall that there was a bit of pushback about that, the concern that it was too big, too much, or that the state wasn't quite ready for that. And again, lowercase the state, not talking about the Department of Health in particular. And so we thought, okay, there really was a lot of conversation around this primary care piece. So maybe volumetrically it wasn't significant, but in terms of focus and just the types of programs that were being developed and offered around this, did it make sense to elevate that, knowing where the direction of health in Maryland was going in terms of primary care shortages, some of the emphases of the AHEAD model, and even some of the workforce challenges in general that the state was experiencing. So I think from our perspective, the staff side of this, we're more than happy to kind of broaden that a bit more if that is amenable to the group. But this was our attempt at really trying to find that, ecumenical middle ground.
Great, thank you, Shane. Any other comments on the themes and the report structure?
Hi, this is Tosin.
Yeah, Tosin, I see your hand up.
Yeah, one thing that we've talked about over and over is centering economic gains across these themes. So I think while it's not necessarily the focus of of most of the recommendations, I wonder if there's a way we can integrate it as part of the themes, maybe health as economic driver, something like that, or is that going to be part of our aspirational section of the report?
So that is a good point, right? In terms of how we look at this, and right, we sort of had that theme when we met with Judy and Megan from the CDC Foundation, as we were talking about the health is wealth concept, right? And how does that fit in, right?
Yeah.
That I think is a good point, to make sure that it's emphasized, right? Whether it's within the realms of a tagline, right? Where we talk about health in all policies, health in all places, health for all, right? Is that part of it? Which is, it goes beyond, oftentimes people's, definition of health, right? Going into the concept of how it plays a role in the economy of this state, right? In these difficult times. Sarah, I
Yeah.
see your hand is up.
Yeah. Sorry, let me just, I
Yeah.
think, yeah, thanks. I think it's really important to emphasize it because we don't want people to view us as, proposing further expenses, right? Looking at public health as a cost center, right? But something that really drives economic gain. So yeah, thanks.
Yeah, Sarah, is that?
Yes, absolutely. I was just going to make the comment, I think, to say that as you mentioned, Boris, we've definitely had those conversations. I think those have been a bit more in the context of the briefs, as we've mentioned before, these ideas of how we're going to sort of present a narrative, an overall narrative, lesson as a theme of the recommendations, given that I think looking at the recommendations, there's not so many that directly speak to that. But the larger narrative, and I think you were just sort of speaking to this earlier, is that to draw that connection between health is wealth and investment in public health, having multiple benefits. But as far as a theme for the recommendations, we weren't quite sure if that was as good of a fit, and that's why it's not included here on this list.
Mm-hmm.
So I do think maybe there's been some conflation between the ideas for the brief and the themes of the report. So it's a good time, I think, to check now with the group to see what does make sense here for the report.
Right. Yeah, I mean, I think if we're talking about themes for the report, certainly based upon the recommendations that we have, I think, again, this is my opining that the themes as presented here are great themes. The part of it is going to be, how do we tie in, and whether that's done in a summary, aspect of the importance of this, for the economic health of our communities as well, right? And maybe it's not a separate theme as it is something that interlaces all the themes, right? The importance of this and the prioritization of public health in the bigger picture.
This is Camille. I think the same can be said for weaving thematically this idea of health equity and addressing disparities throughout all the rest, as opposed to what it's often siloed segregation into as a well-meaning intention, but not folded in. Like, well, how will we advance equity in primary care? How will we advance equity in public health? I mean, I really resonate with Maura's statement. or question in the comments, should it read healthcare and public health? As you've mentioned, Boris, I mean, healthcare delivery is different than health and wellness.
Right.
And, you know, at the Maryland Department of Health, we are really most concerned and charged with healthcare delivery, but social drivers of health and wellness, which we don't have the capacity to do. We don't necessarily manage redlining or transportation or equity around economics. But I mean, they go hand in hand. They are the upstream, as we all know, the upstream drivers of public health. And so it's a tension, and certainly maybe not one we can take on here, but I feel like if we are going to be leaders in this space and visionaries, we sort of, and this is a value that we ascribe to, and not everybody, we might not, you know, it might make sense to think about thematically how we sort of lift that up in all that we're doing.
Right. Very good point, Camille. Thank you. Others on this topic matter? Tosin just wrote in agreeing with your point, Camille. Any other reflections on this?
This is Maura. I just put my hand up, but Camille.
Yeah. Oh, yeah, I see it now. Go on, Maura.
Camille just made me think of something that I'll just say, because maybe it doesn't make any sense. So the tagline is health in all policies, health in all places, health for all. For me, that's talking about health equity. So having a separate health equity fourth bullet is almost it goes against sort of the health in all policies, health in all places, health in all. I mean, I get it, but this is sort of like a nuance thing here.
Sorry, I'm not sure I follow the specific ask there.
So in other words, what I heard Camille say, this is what I heard, but, you know, sort of we're pulling out health equity, which I understand why we want to call out health equity as a separate bullet up there, as a separate theme. In the tagline on the slide, it has health in all policies, health in all places, health for all, which is infusing, in my mind, health equity into everything so that health is everywhere for everyone in all places. So to pull it out as a separate theme almost is contrary to the tagline.
That's helpful. Thank you
it's
for
a
that.
Subtle nuance, that's all.
Great, thank you, Maura. I also received some comments from Amelia, and I want Amelia actually to speak out to any of your reflections, since Amelia was the lead of our assessment team and played a key role in the assessment aspect. Whether you have any comments that about the report structure or any of our other discussions, Amelia. I'm sorry I neglected you earlier. Amelia?
Oh, and I'm sort of an audience member in this context, Boris, so no problem. I think that what was said earlier, I think, Camille, you expressed the idea that we have to prioritize things. And then Mina, I understand the complexity of that. I think what I would offer is there is probably a need up front to prioritize the problems that we are trying to solve. And that speaks to the urgency. So if we were to put those things first in the report, then talk about the themes for the recommendations as ways to address those problems and pair those clusters of recommendations with the problem that we're trying to solve, and then paint the vision of what that could do if we addressed it. So I think that's how I'm envisioning the report structure myself, and that these themes that are on this slide are the middle part. They're the operational driver of the vision based on the findings about the problems that we have in Maryland.
Thank you. And Amelia, I see you more, you know, as a member of our team than a audience member. So don't you played a key role and you have observed this whole process from a very different angle as being part of our assessment team. So first of all, I want to again publicly acknowledge you and your team's efforts in putting together the assessment, the excellent assessment done, but also you do have a perspective that I think is important for us to hear. Anything else, Amelia, from your perspective?
No, I think that that's fine. I think that it's just important for people to understand that the report structure will have more context in the beginning, more summarization of the recommendations, and it'll try to make a compelling argument for the urgency, which were things that I heard from people today.
Great, thank you. Tosin, I see your hand is up.
Yes, this might not be popular, but we might want to consider it. Among the themes to prioritize, we might want to include a list of recommendations that have legislative implications, the ones that we know, and this might require us working with, Senator Lamb, Delegate Eda Bagnall, the ones that we know that they must, go to the next legislative session. That might be a theme on its own. That's just, one of my thoughts. Yeah.
Well, and I think there's a reason why we had members of the legislative branch assigned to this commission, right? So we are not supposed to be, not consulting with this. This isn't a political, a statement. It is a sense is that we have commissioners, much like we had commissioners from, designated from the Maryland Department of Health. We have the commissioners delegated from the House of Delegates and from the Senate, who we should consult with as well, right? So I agree with you totally that one way of looking at this is at some point, making sure that from their perspective, we sort of hear what's, they're the ones that we're going to be handing off part of this to, right? You and I, Tosin, don't sit in the House of Delegates or in the Senate, right? But we have commissioners who do, and they are best suited to be able to provide that pathway, right, for us. So I agree with you that looking at it from a legislative aspect is going to be important.
Thanks.
And from the staff perspective, I'd say, we definitely agree that having the recommendations broken out by what is more policy oriented or administrative in nature versus what is legislative and really requires close collaboration with legislators is important. But I think that list could also be provided in a different area or modality that doesn't necessarily rise to the thematic level, with this being really oriented more towards kind of the narrative that the commission is trying to tell about the importance and the level of effort of this work, as opposed to kind of an operational approach to how do you implement a set of recommendations. So agree that it is important, but wonder if it's maybe better suited in a different format.
Great. Any further comments on this?
So based on the brief chat that we've had here today, I've made a couple quick tweaks on the slide if you haven't noticed that. So welcome additional feedback, or tell me if I've gotten it wrong or it's not landing correctly.
And also, as we look at this one more time here, I think this was brought up earlier. We're down to just a few meetings left that I'll describe shortly, which means that commissioners, from your perspective, there's open homework time period between now and the conclusion of our final report. So if there are comments, as I think Sarah had mentioned, make sure you're getting information to our staff and our leadership team. Look through the recommendations, as often as you possibly can, because we're at that point right now, right? It's, the 0.2 miles left in the marathon. We're all a little bit tired. We're all a little, but the finish line is in sight. And, you know, it is worth to sort of get into that status of, you know, you want to finish strong, you want to finish looking good, because there's always a photographer at the finish line. So I've done 4 marathons in my life, and the last part of it was always the most difficult because you're really tired, but you also realize that there's going to be a photographer to picture your look on your face as you cross the finish line. You got to be smiling, you got to be strong, you got to have a kick, and that's what we're looking for as we reach this last session of our time period together. Any other comments on this report structure and themes? Okay, let's move on to last part of our agenda then. Thank you for everybody's who's put in. It's really under the auspices of new business. And the new business is there anything else that you want to share as commissioners? Feedback, concerns, other items that have not yet been addressed under this new business section? And once again, I'll ask you to raise your hands if there's anything that we have not covered at this meeting. Okay, that's good. That means we've covered everything that everybody wanted to say. I see no hands being raised, in which case we'll go through our last segment of our agenda here tonight, announcements and general updates. Our next monthly meeting is Thursday, August 21st from 2 to 5. This will be a hybrid meeting in person at the Lansford Road address in Upper Marlboro with a virtual option. Dr. Mina Brewster will be presiding at that meeting. We're looking at other deadlines and announcements. A September 11th meeting is virtual, and that will be determined if it's needed, but please, please, please keep it on your books. And the final meeting is going to be September 25th in person. That's going to be sort of our closure meeting and a little bit of a celebration. And we're looking at securing a space in Annapolis for that, for us to all gather together. So any other updates, Shane, from you on the future meetings?
Just that reminder for the work group co-chairs, we'll be holding a workshop next Wednesday at 4:30 to review responses to the open comments we received.
Great. And certainly for those commissioners who are interested, that's a meeting for you as well. If you'd like to attend, let us know. It's going to be the lead co-chairs of the commission with co-chairs of the working groups, but I think that'll be a fascinating meeting. So we'll make sure that information is shared with you. Final comments, anything else that I didn't cover before I ask for a motion to adjourn our meeting? Any other final comments? Going once, going twice, and going 3 times. Okay, I'm going to call for a motion to adjourn.
So moved.
That's Mina, so moved. Second?
Second.
Maura is second, and let's all vote. Are we ready to adjourn on this summer day? Everybody voting to adjourn, say aye or raise your hands. Aye.
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 Any nays? Any abstentions? Well, I thank you so much. I think I gave you back a half hour of our time, but I think we've had a very good discussion. To those of you who have been on vacation while attending this meeting, thank you for your dedication. To those of you who have had vacations in the past, I hope you came back well rested. And those of you who have future vacations, I hope you enjoy your time. This is a key component of our lifestyle, isn't it? That we take a break. And I do pray that you take real breaks. Disengage, refresh, and then let's get set for, this last stage. So thank you very much for your attendance here today.
Thank you.
And we'll see you at the next meeting. And don't forget your homework. Keep looking at this and commenting. Thank you all.
Great. Thank you, Boris. Thank you, Shane.